Remember this scene from the Knicks championship parade in New York City? A man appeared to have overdosed on that structure. And this is Simone Kelly. She's an EMT who gave him naloxone that might have saved his life. We don't know what he might have taken that day, but the response is an example of harm reduction, which happens often at OnPoint NYC, where I met her. It's one of the only places in the country where anyone can walk in, register, and shoot up heroin.
I, saw what OnPoint was doing about a year ago, and I was just so excited for the opportunities that came from it. We have a real epidemic going on.
Kelly and I got a tour of OnPoint from director Sam Rivera.
Being able to offer that all in one place, not something we want to do. Like people want to be a one-stop shop. It's not something we try to do, but oftentimes find ourselves having to do.
So he himself did time in the 80s for dealing drugs, and he sees his role now as giving love to people who don't usually get any dignity in their daily lives.
So yeah, we've seen many. We've served thousands of people. We've seen hundreds of people come through the program, come into the OPC, use the OPC, and then either reduce their use or stop totally. A number of them are working for us right now. We're really excited about that. Others move on and work for other organizations. Specific to the OPCs, we have a little over 7,000 registered participants, been open 4.5 years. In that time, we've had close to 2,100 overdoses with no deaths, which is pretty amazing. We're not surprised because that's what's happening. We've collected, and it's a big one, over 5 million units of hazardous waste. Hazardous waste that stays in the building, we get to dispose of it correctly, never goes out to the street. Those 7,000 plus participants in combining both sites have utilized the space more than 250,000 times. And what does that mean to the community is that 250,000 times people used inside with us, not in the parks, not in the street, not in the playgrounds, not in bathrooms, etc.
OnPoint gets some funding from the city's Department of Health. In fact, Zohran Mamdani, the mayor of New York City, visited in March, and he got the same tour as I did.
And so the services are free for all people?
According to city rules, taxpayer dollars can't go directly to pay staff who oversee the drug use. Instead, it goes to other services, the medical care, or the massage room that we saw, the art therapy, aromatherapy, acupuncture, hairstyling, and other things that are on offer. But we wanted to take a close look at the data. Does OnPoint really save lives? The answer is, it's unclear. So the NIH is currently funding a study that is looking at the outcomes. And what they do is they give surveys to drug users and they look at 911 calls. And what it looks like is that 911 calls and emergency room visits appear to decrease a little bit. But there's so many complicating factors that it's really hard to say. Now, I should note that while this is new to most Americans, there are over 100 centers like this around the world. Canada was a big proponent. The first one opened up in Vancouver in 2003. So there is good data around those. And essentially, the research is unclear. Does it actually save lives? They do bring people in the door who might go in for medical care. They might get their drugs tested and find fentanyl and then not use when they otherwise would have. But when it comes to the actual mortality rates, the NIH's National Institute on Drug Abuse found that after 20 years, while no one has been reported to have died inside any of the overdose prevention centers, it is, quote, unclear whether such facilities reduce overdose death rates overall, end quote. Enter Charles Fain Lehman, one of the loudest critics of overdose prevention centers, from his perch at the conservative-leaning Manhattan Institute think tank.
I think that if they wanted to operate these facilities primarily as an off-ramp for treatment, that would be great. I think it's somewhat hard to argue that that is what happens consistently, or many of these facilities don't do that consistently. If you look at my analysis of OnPoint's data, small fractions of people who go through their facility end up getting referred to. Anything that looks like maybe it's treatment, in the data that I looked at, they aren't particularly clear about what fraction of clients are getting referred to treatment.
I went back to OnPoint to ask Sam Rivera about this.
Like a number, like
Is it like a handful of people that
Oh,
have actually
no.
moved out?
Oh, no, many more than a handful. Literally hundreds, literally. And maybe more. But I don't have an exact number.
At the end of the day, regardless of the empirical data, people seem to be able to find whatever they were looking for in the same data. And most of the researchers that we spoke to, largely funded by the NIH, they're big proponents of harm reduction and specifically of places like OnPoint.